I wanted to do another interview with Mell Scarborough, who is in charge of Magee Healthy Heart Clinic. Magee Hospital is known for its progressiveness. Magee is known as a medical community. And again, I think we're a step ahead of a lot of cities in Mississippi. And this was one of the things that was so interesting to me that Mell talked about is how we are one of the first clinics in this area. And Mell, I wanted you to tell about where there were other clinics, where you kind of got this idea, where it came from.
So I was asked by Miss Althea Crumpton to help start this clinic. She had gotten an idea from other clinics in Hattiesburg. There is a heart failure clinic, I think they call it, and in Jackson there's a clinic called the Chronic Care Clinic at St. Dominic Hospital.
Well, this much I can tell you, I sure like our name better. Chronic Care. I like that better.
I like Healthy Heart. I have gone down and worked with Brad Massey in Hattiesburg, and I worked with Beverly Oliver, who runs the clinic. They're both nurse practitioners, and they are running those clinics, and Beverly is at St. Dominic. And we have modeled Magee's clinic to mimic them and to provide the same sort of modalities of care and the protocols and how we'll do things, how we'll actually manage. And these are national standards of care. They're
Do you find, are they in a lot of other states?
I really don't know how to answer that, Miss Sue. We, in the South, yes.
Well, with the heart disease
Exactly.
in the South.
We're so predominantly heart diseased in the South, the 7 or 11 states that make up the South and the Southeast, and a little strip, up through Tennessee and Virginia. And this is where the need has been shown.
What is interesting to me too is that how you said it really worked with a patient. That if I am, for instance, Dr. Pruitt's patient, and I've had a heart attack, and I've just come out of the hospital, the next initial visit will actually be with you, right?
What we like
and
to
with
do
him
is,
too.
yes, you're going to follow up with Dr. Pruitt as scheduled, and you're going to see your cardiologist as they instruct you to schedule. But what we like to do is make sure that we see you within 72 hours of discharge. That it's a critical time. After discharge, you can build up fluid pretty easy if you don't go home and do the right things. Cut your salt back, take your diuretics like you're supposed to, and weigh yourself daily.
I'm very interested in the diuretic part because this was something that I've been dealing with, and one of the things that was, I would, although mine's not necessarily hard, I would have enjoyed having somebody I could ask questions to, because I didn't realize with mine, if you're on potassium with diuretic, if you're not taking the diuretic like you're supposed to with the potassium, you can get the potassium going that way and the diuretic going that way, and then you're going this way.
That's right.
And I don't always feel like, I think, if you call the doctor and says you're taking your medicine, yes, well, you're really not. So this way, you feel like you have someone that you can go and talk with. If I came to your clinic, what would be the first things that you would do?
Well, the first thing we do on the first visit, if you're in the hospital, I like to come and meet you there.
Oh, that'd be good.
On admission and give you some information. And then on your first visit, you come in and you're shown some video teachings about congestive heart failure. That's the big name for it. We like to just call it heart failure. It just makes things sound simpler and not as scary.
Right.
But we show you videos and educational material. Then I'm going to teach you how to read a label on a can or on a bag of chips. And we're going to learn how much sodium is in that bag of chips, or how much is in that label that says no salt added. There's really some there. So there's some teaching and some learning things to go along. And that first visit will take about an hour and a half. Because I'm going to teach you how to weigh yourself every morning. I'm going to show you a log, how to log it. And you're going to bring that log to me every time you come see me. And the good thing about all of this is you're not going to lose your doctor or your cardiologist. You're going to have me to call anytime you want to.
So I really get a bonus.
And guess what? I'll answer it every time.
Really? I won't have to punch a bunch of buttons.
No, there's no menu. There's just Mell going, hello. And I probably won't say, this is Magee Healthy Heart Clinic. I'll just say hello. I might say this is Mell.
I think that's huge. That's huge. But now, if I'm using a doctor in Jackson and I don't use a local excuse me, Magee doctor, how does that work?
That's okay.
That's not a
fine.
problem.
I hope I get some patients. When I was up at St. D training a few weeks ago, I walked into rooms with people from D-Lo. And they were
okay.
so excited to see me. So I
Yeah.
hope I do get those Jackson patients. I hope that we can keep them at home. And at $3.30 a gallon, we don't have to run up and down the roads.
Right.
And it's so much more convenient for them. I hope this program will expand. You know, I hope that it'll include things like Coumadin management one day. That's our goal.
Okay, bottom line, who's paying? How do you pay? Does my insurance pay? Does Medicare
Now
pay?
that's going to depend on your benefits. And I have a clerk who is with me in the office every day, and she determines and will sit down and talk to you about your pay source, what it will cover, what it won't, and she'll do all that up front with you. And she'll get on the phone with you too.
So you pretty much are taking care of the whole person. I mean, you're not just helping me with my medicines, you're helping me with any financial questions I might have or anything like that. I realize now doctors are so busy, and years ago when they could sit and talk with you for a long time and go, move in that manner, it's not that way anymore. I think this is going to be a wonderful thing for Magee Hospital. I think the Healthy Heart Clinic is going to be quite successful. And going to meet such a need, because so often what people need is to be listened to and to talk to. That, and I find so often that often the doctors don't listen. You hate to say that because I'm not slamming the doctors in this case, but it's they don't have time, and their mind is not trained in the area that you are, because you're coming from a nursing background.
Exactly.
So you're coming from a more of a caring. Oh, I make it sound like I don't think the doctors are awful. And I do not. I love our doctors. All our Magee doctors are wonderful. But I think this is really going to be a great program. And something that will, and I'm so impressed because Magee General Hospital is jumping out there, and doing this and not waiting.
State of the art.
Always. I just, when I have to say anything about Magee to people, one of the main things that I always bring up is what a fine medical community we are, and all the different things that we have to offer. I hope that you, if you have heart problems or have had heart problems, will consider calling Mell. What number do they call?
849-1515.
That is the clinic's number, and then they will.
It goes to my cell phone if I'm not in the office.
So that they always have access to you. Can they just stop by?
Sure, anytime.
Okay,
Anytime.
where's your office?
I'm on the 3rd floor. You get off in Tuscan Towers. Get up on the 3rd floor and go as if you're going to Dr. Pruitt's office, but go all the way down that hall past his office, and you'll see a sign.
In other words, you're in the big building across from the pig.
The big new building.
I guess that's what we'll always call it in Magee, the big building across from the pig. But I've enjoyed talking with Mell today, and I think you've probably learned a lot, because I know that I have. I hope you will consider talking with Mell if this is a problem that you have, or if you have someone in your family. We have Magee News listeners, viewers, whichever you would say, from all over. And so many of our former Magee people watch and have their parents are here or their grandparents are here. Keep this in mind. This is something that you should look into for any of your family members. I thank you for listening to Magee News, and anytime you've got a question or you would like for us to cover something on MageeNews.com, Good Morning Magee, you just call me and we'll do it. Thank you and have a good day.